Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Welcome, everybody. I am absolutely delighted today to be with actually a mentor and a giant in the field of cardiology, someone whose articles as a young fellow coming into the field of nuclear cardiology, I was reading, just trying to educate myself and get even to comprehend a little bit at this level. So I am with Dr. Alan Rozanski, who is a professor of medicine and absolutely a pioneer in the field of nuclear cardiology, and who, as I learned very recently, is coming into the field of integrative cardiology, making an immense contribution with a specific program that he developed. Welcome, Alan.
Thank you. It's a pleasure to be here.
Thank you. So tell me, because, people ask me this question all the time. So I'm going to ask you exact same question that everyone is asking me. And the usual question they ask me is that, well, how did you become an integrative cardiologist? Sort of like, what gives? So how did you become an integrative cardiologist? What happened?
Well, it wasn't a recent journey. It happened a long time ago. And
okay.
If you'd say by accident. I went to medical school. Actually, when I started, I wanted to be a psychiatrist. But when I took my cardiology rotation, I was at Tufts Medical School, and it's divided by rotations. And I was on the cardiology floor. I absolutely fell in love with taking care of cardiac patients. I enjoyed taking the history of chest pain in the patients. It was very interactive and meaningful. Then when I did my cardiology fellowship, the part I liked most was actually putting people on a treadmill, because there was something impactful in terms of watching the patient and seeing how they're doing. You get a lot of information out doing that. So it was natural after that to go into nuclear cardiology. I wanted to get some training. So what happened was I was at Mount Sinai Hospital, but they didn't have that kind of training yet. So I was able to arrange to take a 6-month elective, which was terrific, at Cedars-Sinai Medical Center in Los Angeles. And while I was there, I ended up being assigned a research project under Dr. Daniel Berman, and turned out to be a very impactful study. And as a result of that, I was offered a faculty position at Cedars-Sinai.
So let's stop for a second, because for those of you who don't know, this is the study that actually lifted nuclear cardiology out of these dark rooms where radiologists used to just sit and look at the scans of the heart into what actually became a full-fledged, in time, cardiology subspecialty, and was the first subspecialty that I personally embraced when, I was beginning my career in cardiology. So it's not just any study, it's the study. Okay.
Yes. And, maybe just to explain for your audience what nuclear cardiology is, it's simply where we use radioisotopes, which we can inject to study the blood flow to the heart during stress, or we can look at the wall motion of the heart during stress. In those days, we were doing that as well, where you take people, you put them on a bike, and as you exercise them, the wall should contract in more vigorously. But if there's a significant blockage in one of the coronary arteries, the wall starts to slow down, and it might even stop moving transiently under a controlled situation. And therefore, you have a blockage. That's nuclear cardiology. So I end up doing research in this. And, maybe year 2, year 3, I start, feeling a bit bored by this. It didn't feel like me. I'm like a people person, and I'm sitting reading scans all day, and it just wasn't me. And I was getting less and less happy, but I didn't know what to do with it. So I was here in Los Angeles at that time, and I'm listening to this talk radio show going home. It was called the David Viscott Show. He was a psychiatrist, and he was taking in questions. And I was fascinated by him. And then it occurred to me, wait, maybe he's available to be seen. So I looked him up, and he was. I made an appointment, and I went to see him. I told him I wasn't sure about my career choice.
Mm-hmm.
I started to say, I wish I'd gone into psychiatry or whatever. And he said, what are you talking about? You're a trained cardiologist, subspecialist, just call up the Department of Psychiatry at UCLA and tell them you'd like to be their cardiologist.
That's that simple.
Yeah, I thought that was the most stupid thing in the world. It made no sense to me. But Monday morning after I saw him, that's exactly what I did.
That is too funny. So let me ask you, so first of all, for our listeners, so nuclear cardiology is a subspecialty of cardiology, and it sort of in the same pack of subspecialties whose focus is on imaging the heart, right? So right. We've been fascinated with the heart. We've been imaging the heart in multiple ways, but the big contribution of nuclear cardiology was really the fact that it established cardiac imaging as a functional modality. So the fact that we were able to assess how the heart works, both at rest and with a certain specific workload, that really what became the essence of nuclear cardiology. Until this day, there actually aren't other modalities that offer specifically functional type of testing. Of course, there is a basic stress test without any radioactive isotopes. There is something called stress echo, where we image with the ultrasound, but all the other sort of fancier modalities like coronary calcium scores and CT angiography, they're technically not functional because the heart is at rest. So they're more of an anatomically plugged in cardiac imaging modalities. The functional modalities, let's see how the heart does when someone performs a certain level of exercise. That's really where nuclear cardiology lives. So, Alan, this was not enough, and you wanted to go into a different journey. So, what did you do as a cardiologist for a psychiatry department?
So, I called the chief of psychiatry. His secretary asked, "What's this all about?" I explained. Didn't even expect a response. About 3 days later, she calls me back and says, "There's a doctor you should see at UCLA. His name is Dr. Herb Weiner."
Okay.
So I made this appointment. I had no idea who he was. Turned out that he was a towering figure in psychosomatic medicine.
All right.
And we're talking, and he tells me about this new initiative in the MacArthur Foundation, which they'd started a network to study the determinants of health-promoting and health-damaging behaviors. And he said they were going to supply a sabbatical fellowship for somebody, and that it was based on proposing research. Mm-hmm. And it had to be multidisciplinary. Okay, so that's what he says to me.
Wow, what year was that? This sounds like very
back around 1984 or so.
They had a tremendous sort of foresight for the future, because these words, multidisciplinary and neurobehavioral research, was not really in a common doctor vocabulary back then.
That is absolutely correct. Absolutely correct.
Wow.
That's right. So I went home. Sometimes the good Lord puts ideas in your head, with moving the scenes behind us. And I thought about this idea of stressing patients in the laboratory. And at that time this was an era where this whole work had been coming out in terms of what we call silent ischemia. Ischemia being lack of blood supply to the heart. And we were able at this point in time to put ambulatory ECG monitors on people and look at them during daily life activity.
Well, let's tell the listeners in case they may not know, right? So silent ischemia is ischemia where the heart muscle is lacking in blood supply, at least temporarily, but the individual who has this heart inside of them is actually not aware that this is happening. They don't have any symptoms, nothing is going on. But, since nuclear cardiology and actually a lot of other cardiac imaging techniques are very well positioned to figure this out, we can figure this out. And we can even, we know from certain patient populations where this is more likely. For example, older patients, female patients, and so on and so forth. Am I correct on this?
Perfect. Perfect. Absolutely. So, what was being reported at that time was people were having these silent ischemic episodes while they were driving the car, doing different types of daily activity. And they were occurring at low heart rates compared to when people would get on a treadmill and we would induce the same ischemia. So it was not well understood at all. And I was fascinated by it. And I said, wait a second. Maybe there's a way to model this in the laboratory. Instead of just studying patients coming in and putting them on a bicycle and exercise them, why don't we put them under various tasks, mental tasks, designed to induce stress? So I went back to Dr. Wine. I told him the idea. He loved it. But I said, I need some help with this. So he actually introduced me to some psychologists. And they came up with a battery of tests, of which one was, like doing serial seven subtractions. Another was a cognitive stressor. And one of them was just patients to merely speak about the stress in their lives.
Okay? Interesting. Okay.
So we set up the protocol, we get it going. And the second patient we do was a man about 60, and he was a person about to lose his job. And while he is talking, he's about the stress of losing his job. We're looking at the electrocardiogram. He's getting some abnormalities. Then we're looking at the wall motion of the heart. And as I said before, in a normal heart, it's going to, be more vigorous with exercise. Now he's just talking about stress. And lo and behold, about half his heart stopped moving while he's talking about the stress that he's feeling. We ended up studying about 40 patients. And the interesting thing was that about half of them showed these kind of abnormalities.
Just speaking about the stress in their life, not doing any specific task, just really talking to someone about the stress in their life.
Yeah. And let me hasten to say that these were patients with significant heart disease we were studying. Okay. And in those days, heart disease was more severe than it is today.
Sure.
But we did study normals, and none of this occurred in normal people, so people shouldn't get overly excited about this. But this
we're going to come back to that, because we're going to talk about what actually is and isn't normal, right? Because the definitions have become a little bit more fluid for a number of reasons. But please continue.
Absolutely. But this was an aha moment. I mean, I was stunned by the results, and I couldn't walk away from it. And I was now part of this MacArthur network. I should add that I had gotten the sabbatical fellowship just on the basis of applying with this idea. And this was a 2-year sabbatical fellowship. So now I was finding myself on different medical campuses at Duke, at Bethesda, at Yale, and meeting, people in the world of this new budding field, looking at, we could call it psychosomatic medicine or, behavioral medicine, behavioral cardiology. But I'm meeting, people of different sorts. And for about 2-3 years, I began to study the effects of acute stress on the heart in different ways. But the key thing was that as being part of this network, there were people looking at the effects of chronic stress. Right. And I was seeing their work. I was seeing, for example, this animal model work by Dr. Jay Kaplan, where they had an animal model for stress, and they controlled the diet and everything. And lo and behold, the stressed monkeys were developing more atherosclerosis. There was Barry Delman at UCSF, who was looking at the effects of stress on eating behaviors. And it was very academic, important research, and was showing important effects. I met Bruce McEwen, who was at the Rockefeller Center, and was looking at the effects of chronic stress on brain function, brain plasticity, and showing that people under chronic stress and animals under chronic stress would develop an enlarged amygdala and shrunken hippocampus and prefrontal cortex.
So basically, they were, paving themselves a road to dementia.
Yep. Yeah, absolutely. So I began to look at the effects of chronic stress. And then over time, it started to increase. I said, well, wait a second. We can be more precise about this. We can ask this key question, which I began to formulate, decades ago. I said, what is objectively healthy? What is objectively unhealthy? What's healthy is those things that, protect you against the development of disease, protect physiology, and promote lifespan. And things which are, disease or disease promoting do the opposite. They cause disease, affect physiology in a negative way, and shorten lifespan. So, for
So,
example,
so in
smoking.
functional medicine, because I'm an integrative and functional medicine doctor, in addition to being a cardiologist, sort of fusing the two, we very often talk about a concept of hormesis, right? And hormetic threshold. And so we know that a certain amount of stress, certain exposures, actually, when they do not overwhelm our hormetic threshold, are actually conditioning our system and are building resiliency. But once you overwhelm that hormetic threshold, go sort of cross the red line, if you will, this is where the impact of stress becomes detrimental. And I think what you're describing, and I will be very interested to learn how did you and other investigators at that time actually defined what chronic stress is, because I'm seeing in a lot of patients and in my life, in myself, in my friends, in my family, that there is less of this super acute one-time stress exposure. Of course, they do happen. For example, negative news, illness, things of that nature. But there is more of these chronic and repetitive stress exposures that over time really begin to overwhelm our ability to defend ourselves, and our resilience basically crumbles. Our entire base is undermined by these chronic and repetitive stress exposures.
That's an excellent point, and it's so interesting about stress because it's there's two sides of that coin. The stress that is chronic, that you don't feel you can control, it doesn't have seems more meaningless, which causes emotional distress, and you don't have a sense that you can control it. That's the kind of toxic stress that is damaging over time. But the flip side of that is the stress that is the kind of stress we pursue when we're engaged in meaningful goals,
Mm-hmm.
or experiences where we've had to struggle, but we've overcome them and then have that sense of growth. Those are the things that build a sense of optimism and resilience, and even a sense of pleasure and self-esteem, that we became bigger, that now we're able to be wiser and, let's say, more humble, or be built in different ways. So it's a very interesting duality about stress.
Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. Discussion often gets heated and confusing. There are those who push for low fat, low cholesterol. Then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is owner20, and I'll see you in the office hours. Well, that purpose, I actually just came back from a conference, our annual international conference in functional medicine, and we had a fantastic talk from functional medicine physicians who practice with our veterans. They're in the Veterans Affairs systems, and they have developed something called Whole Health Program, which is focused on helping the veterans who suffer from mental health issues to find purpose, because purpose actually is linked to lower incidence of dementia, and even has a mortality benefit. And that's exactly, I think, the type of stress that you're describing, stress that fosters growth and resiliency through purpose versus stress that sort of is a negative influence and undermines a person's foundation and connections.
That is absolutely true and key. And I'd like to come back to that, but I'd like
Mm-hmm.
to, just tell you this progression in order, because it's a story. So
Sure.
what happened was, I'm looking at the issue of chronic stress, looking at the issue of, well, what else falls into all of this? And back in the mid to late 80s, there became a lot of interest in depression,
Mm-hmm.
and its relationship to heart disease. Now, today, everybody accepts that depression is a risk factor for heart disease. But I can tell you back in the 80s that it was not accepted. And there was a lot of skepticism about that. So we began to look at that, and there was a lot of research coming out. And really what came out of that was you see that depression, when people are depressed and it's not well treated, all of the physiological systems of the body, major physiological systems, start to go haywire. You have very high, cortisol levels. The sympathetic nervous system is revved up. And then you have all these peripheral effects. The nervous system gets out of whack. You develop visceral fat. You develop inflammation within the endothelial lining of the arteries. The brain, again, the amygdala enlarges. The prefrontal cortex, becomes less. And there's a much increased risk of heart disease. So that was depression, chronic heart disease. And then I began to look at these other domains. We wrote a classic article back in 1998. I got a call from Dr. Willison, who was at that time the editor of Circulation. And he asked me to write an article on the relationship between stress and heart disease. And I knew this was, an opportunity.
Sure.
Opportunity to influence the field because it was the leading cardiology journal. So I made that about a 5-month project.
Only 5 months project for a Circulation article?
Yeah. I reviewed every article that I could that had been written on these different factors.
And boys and girls, this is without ChatGPT or artificial intelligence. This is the OG, original research. Just remember that part.
That's a great point. Yeah, so we ended up emphasizing, besides depression and anxiety and chronic stress, the role of social isolation and lack of social support, by which that time there was already a very substantial growing literature. It was still a young field in terms of looking at the social domains of stress. And we were looking at work stress and things like that. And we wrote this classic article. And by the way, when we submitted the article, there was nearly 300 references. And I get a call from the editorial staff saying, I'm sorry, we don't accept articles with 300 references. And they wanted me to delete, about 2/3 of them. So I got in touch with Dr. Wilson. I said, look, can delete the references, but it won't be as meaningful to your, audience.
Yeah.
If we don't include that because there's so much skepticism about the role of these factors.
And stigma, I think, you're talking about 1980s. 1980s mental health, emotional health, in many regards was still sort of stigmatized and really not talked about.
Right. Absolutely. So he agreed, and the article was published, and we were kind of off to the races in that way. Well, back a few years earlier, when I was first getting introduced to all of this kind of work with the MacArthur Foundation, I had been at the UCLA. Now, Cedars-Sinai was part of UCLA. And I'm in the bookstore, and I see this bright red book. And I pick it up, and it's called The Healing Heart. It was written by a person named Norman Cousins, who at that time was a very famous philanthropist. He'd been an editor of different journals, and he had written a book a few years earlier called The Anatomy of an Illness, very famous book where he talked about overcoming a musculoskeletal disease. And now he was writing a book about his journey in terms of recovering from a heart attack.
Okay.
Which he said he used positive emotions and humor to do that. So what happened was, I said, wait, he's at UCLA. And I called up his office. And I asked if I could make an appointment to meet him. And they said yes. So we did meet. And he had a profound influence on me because he was all about talking about the effects of positive health on protecting you against disease. So this was in the background because I was aware that, wait a second, all I'm doing is focusing on what are the negative factors which cause disease, but not looking at the opposite side.
That's tremendous, right? We know certain things are bad. So what are the good things that we can actually bring in that could shift this, balance in our favor?
Yes, absolutely. And at this time, It's funny how all these things happen together.
Mm-hmm.
A literature was starting to come out about the importance of positive emotions in promoting health. There was something called the nun study, where they looked at the diaries of nuns, and they found those who had more positive content were living longer than nuns who had negative, content in their diaries. And then the work of, Marty Seligman and others developing this positive psychology movement was coming out. So I was eager to pay attention to all of this in terms of medical effects. So it began to expand my horizons, not just looking at the negative factors, but the positive factors. So at this point, I began to focus on optimism versus pessimism. Now, I wasn't doing the initial studies. I'm kind of a redactor. But in a short period of time, the first kind of important studies were coming out around the year 2000. But in the course of the next 10, 12 years, about 12 studies came out on this. We were able to do a meta-analysis, which was published about 6 or 7 years ago, and showed indeed that people who have a more positive outlook in life live longer and live with less heart disease.
How's the positive outlook being measured, Alan? Like how does a person, for example, know other than subjectively, do they have a positive outlook or not?
Great question. So there's been different ways that this has been measured over time. Dr. Seligman looked at people's speaking style and talked about how people, whether they talked about stress being pervasive and, or whether it was just limited to that factor, whether you took self-blame or looked at external factors and whatever. But the fact is there were two people who developed something called the life orientation test with a lot, and it is a 6-item test that asks about people's sense of being optimistic for the future versus negative. And there's some filler questions, and it's a 6-item questionnaire. And this has become the standard in the field. And it has been used in younger people and older people in the US and in other countries. And it's been tied not just to cardiac outcomes, but whether people are less likely to develop dementia and so forth.
Amazing.
And the results have been astoundingly uniform, that it's a very predictive scale, which is pretty stunning, when you think about that. So the data is pretty clear here that optimism is a very important positive factor in terms of being a health factor. In other words, it decreases the risk of disease, promotes physiology, and lengthens lifespan, and pessimism does the opposite.
So is this life optimism test is something that an individual perhaps nowadays could just take on their own? Because I would love to drop a link for our listeners to take life optimism test, courtesy of Dr. Alan Rozanski, so that we can all score ourselves.
Here's the thing about that. I thought a lot about this because when we published this optimism meta-analysis a number of years back, there was a lot of press about it, and I was getting calls from different newspaper outlets or whatever, and one of the key questions was, well, how do people become optimistic?
And how?
And I said, look, optimism is an indicator that other things are working well in your life. But to just try to become optimistic is just, it's too high a reach. People who are optimistic have a sense I can handle the things that come my way. And that builds their hope of expectations about their future. So if you want to build big optimism, first you have to build small optimism. Incremental
steps. So I tell my patients, patients about learned happiness. This is what I call it. I call it learned happiness because I tell them happiness is something that you can actually learn. You can learn to be happy in the moment. You can learn to see a situation as a glass half full versus a glass half empty. Obviously, not every situation is like that. Some situations you're either super happy or super sad, but a lot of it is not just about the situation. It's actually about how we react to the situation, what mechanisms we have to the situation. And these small incremental reactions actually affect our mood on a more global scale. And what I find, at least personally, and also from some of my patients, since, we're swimming in trackers and, I'm a gadget person, my HRV, my Aura ring, it now measures stress levels on a daily basis using DHRV. And it tells me, oh, you're engaged, or you're relaxed, or you're stressed. And then I'm thinking to myself, that's interesting, I don't feel bad, but it perceives me as being stressed versus other times where I also don't feel bad, but perceives me as being engaged, right? So you're talking about this good stress versus bad stress. And I think, there is a physiologic component to it that I think also informs us how we think about it as a mental construct. Do I feel good and optimistic today, or do I sort of feel like, not my day today, right?
Right, exactly. Absolutely. And so these micro steps, these small steps, as you say, I think that's the key. Don't. It's like if you're starting to work out and you've been sedentary, you're not looking to hit the guidelines right away. You're trying to go 5, 10, 15 minutes, right? We build up all that up incrementally.
Of
And we
course.
have to build that up, in terms of the, let's say, mental outlook as well. So intuitively, when I was being asked these questions, I said, don't start with optimism. And I said, start with gratitude. And the reason I chose that was that if you take these negative mindsets, let's say you're pessimistic, when you're working on negative mindsets, you have to also deal with the emotional overlay as to why they're there. Mm-hmm. It's much easier to start to say, well, let me just start to build in a positive mindset. Gratitude is one that people have no resistance to. It's not an easy thing because, by nature, a human being by nature is built to take things for granted.
Right.
It's not how we came into the world, and when you're 5 years old, you wouldn't talk to a 5-year-old about gratitude. But when do you start? Was it in high school? Was it in college? The truth is we don't do the work.
I actually, so I did an episode a while back called My Top 5 for 2025. Right. And, it was about showing grace to yourself. And I talked a lot about gratitude because in my, I'm fortunate to be able to work from home most of the time. And in my home office, I have this little corner with the pictures of my family. It's just a few pictures and some of the cards that, my kids gave to me when they were young. They're all young adults now. So, so I don't think I even get cards anymore. But the point is that every day when I walk into my office, I stop at that little corner because that's my gratitude minute, if you will, right? It resets me. And no matter what comes, I am so grateful for everything that came before that, I'm sort of in a different mindset, as I go into the daily challenges, and I think you are super right that it's not about some sort of a very involved, very expensive, very long, very sophisticated routine. It's really about those moments. I actually call them micro breaks. I tell my patients, take a micro break, right? A minute or two just to reset yourself. Step outside, think about something positive, look at the photos from your past trip, things like that. There is also a concept that I recently discovered that I think is similar to what, or related to what you're describing, and it's called joy conditioning. Right. So this joy conditioning is when you actually are reliving positive experiences, you either repeating them or reminiscing about them at the moments when you may not be feeling as happy. And that, of course, brings or resets us into a happier mode.
Wow, that is fantastic. I kind of make the same point about gratitude. Oh, by the way, I listened to your episode on 2025. I was particularly struck by that idea of your gratitude corner that you had mentioned in the podcast. And what it represents, I think, is you came up with a technique, an idea for gratitude, for your cue for gratitude.
That's
and
right.
I think that idea of cues and people coming up with their own ideas about gratitude is really important. And secondly, that not to underestimate the importance of just taking a couple minutes out a day for that.
That's right.
And to say, hey, you know what, it isn't so easy, because it just isn't. We have to work on this until we make it really habitual, and also give ourselves the opportunity. Well, we tried it, it didn't work, but we get back on the bike again, and eventually it will take if you work on it, and it can make a profound difference in people's lives. And that's an example of where you're changing and building a positive mindset. And these are the things that lead to optimism as well. So that's very true.
That's amazing. And I have to tell you that I, earlier on in my cardiology career, right, I personally came from a society and from a family where the whole sort of touchy-feely thing wasn't a thing, right? So it just was not favored and was not considered in that, particular society. And at the time that this is what you're supposed to be doing. You were supposed to have a strong front, right? You were supposed to be hard, never be soft, whether you're a man or a woman. So coming into a field as scientific and sort of technical in many ways as cardiology, that has everything. A lot of things have been evaluated and quantified and standardized. I never even thought about the fact, well, what sort of role does our brain, our emotion play, until there was one day when myself and my co-fellow, we were, I think, first or second year of fellowship. And he was from another country. So he got his physician training in that country and just came to the US for the cardiology part. And so as we were rounding in the coronary care unit, we saw a couple of patients whose heart rates were going fast. They just had their heart attacks. We needed to slow the heart rates. And he said, let's give them morphine. And I said, morphine? Why would we give them morphine to slow down their heart rates? And he said, you'll see. Once they relax and they sort of fall asleep, and, at that time it was, the norm, those were early days as, or late 1990s. He said, once you give them a touch of morphine and you take this edge off and they sort of relax and come down, you will see their heart rate come down as well. And sure enough, I said, okay, let's do this. This was sort of was just like him and I, we were holding the fort, as they say. And that was a tremendous learning experience for me. And years later, I happened upon an article. It was, I think, in the Journal of American College of Cardiology, or JACC, from the doctors Peter Libby and Ritker. The Harvard group has done a ton of work on the connection between brain and perceptions in the brain, the stress level of the brain, and actually cardiovascular outcomes. And they described in post-MI patients the echo phenomenon, a phenomenon where being upset, being stressed, obviously people who had a heart attack certainly are stressed, or maybe they have a cardiac procedure and they are stressed, actually led to physiological activation of immune system with recruitment of cells like macrophages, leukocytes that would actually go to the site of the coronary plaque or any area which is injured in the coronary arteries and participate or attempt the plaque remodeling, right? And that was the echo phenomena, where we literally from our thoughts could initiate the biological mechanism of atherosclerosis. And that article had a profound impact on me personally. And, I stopped underestimating the brain-heart or the mind-heart connection at that time.
Right. Yeah, that's fascinating.
Hi, everyone. It's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Heart Centers have launched Heartwell Toolkits. A curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticcardscenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping.
So when you come back to your question about the 6 domains of health,
so tell us about the six domains of health, right. And maybe I'll go ahead and I'll share a screenshot as you're speaking.
Sure. So when you think about it, we've covered a number of them. First, you start with physical health. Are you exercising? What's your diet like? Are you sleeping well? Because all those factors.
So let's backtrack just for 1 second. So in how did you I'm assuming that as part of your extensive research into this, you have developed the 6 domains of optimal health, right? When did you launch the 6 domains of optimal health?
It was a progression. It was, I talked about the article in 1998 where we had already covered the emotional domain in terms of depression, social domain. We covered stress for sure, and physical health is a given. What we were lacking was the mental part at that point, which got filled in with optimism, pessimism. There's data showing that people are more forgiving in nature, for example, have better cardiac physiology, and certainly not a lot of data with gratitude as well and its beneficial health effects. Well, if you look at these 6 domains, and we cover physical health, mental, vitality, emotional mastery, social connectivity, stress management, what was missing here was a focus on, purposeful living, which we had talked about briefly before, but it's a profound area. And it is, I think, now gaining traction as an important health domain that we have. And it's very exciting because there's a big handle on this. The first study is looking at whether your sense of purpose was related to greater lifespan, only came out about 10, 12 years ago. And so we did a meta-analysis on this back about 5, 6 years ago. And lo and behold, just like with optimism, people who have a stronger sense of life purpose live longer and live less heart disease. And people with a low sense of life purpose, it's the opposite. People with a sense of strong life purpose also have a lower risk of developing dementia, even in the face of organic evidence when people come to autopsy that they could have or should have had perhaps dementia, they were less likely to have that. That's the work of Patricia Boyle at the University of Pittsburgh. And other outcomes now are being associated with better, sense of life purpose. So it's a very profound area, and that rounds out the 6 domains of health, if you will. Now, each of these are completely, evidence-based, and each one of these areas has a continuum from positive to negative, and they're all interrelated in one profound way. Each one of these areas, when you're functioning well, produces a greater sense of vitality. By vitality, I mean an inner sense of feeling energetic, which is pleasurable and tends to be activating. And why is it activating? Because when we have a greater sense of vitality, we want to do more. And we want to do more because we have the sense of purpose. So it's all interrelated.
Interesting. So after I discovered sort of this mind-heart connection over time, especially pivoting my practice and my focus into a more holistic, integrative way, I started exploring various tools that could help people to foster this sense of mental vitality. And I actually discovered a great tool. I'm sure you know a lot about it, called Heart Math. Validated in multiple studies, used in multiple settings. And what's interesting about it is that how it connects a physical action, which is, of course, a certain breathing sequence, with the thought process, fostering heart coherence and getting us fairly quickly, of course, with practice that is repeated, into that mental vitality zone.
Right. Very true.
So, Alan, so the 6 domains of optimal health, is it something measurable? Do you, for example, have a way to tell a person where they should do a little bit more work, or and where maybe they're already good or making progress, sort of like, because I would assume that in each individual there is some variability, right? Someone may be doing really great with regards to some of these domains, but still needs work in other areas, right? In other facets.
That's a great question. And I'll tell you that the other day when I was listening to your podcast here on, 2025 goals, and you mentioned, you called yourself a gadget girl, a person who, and it's coming out in our discussion where you do use all these different fascinating techniques to assist people in understanding where they are. It made me think about that question. So I anticipated your question, if you will. So there's a flip side to having sophisticated ways to measure things, which is there a simple way that people
Exactly.
can use? And there is. We talk about vital signs, people take heart rate, blood pressure, whatever. In terms of health, I say the vital sign is your sense of vitality. How energetic are you feeling? And if you're feeling very energetic, that's great. And if you're feeling less than energetic, or you're feeling, not necessarily even fatigue, you just don't feel energetic, then something's off in one of these 6 domains.
But it's hard to quantify this, because I think a lot of the time when people talk about energy and, in the integrative functional medicine arena, this is a very common complaint, right? Fatigue, lack of energy. And we talk about, of course, mitochondrial health and how we can improve mitochondrial health. And of course, its relationship, a very strong relationship to metabolic health, metabolic flexibility versus metabolic rigidity. But I think what you're describing goes beyond just, feeling tired. It's more of what I personally feel is described by the expression zest for life, right? Because,
Right.
right, do we have this, and we all came across those individuals that maybe they're not very great with their physical health and certain things are happening, but they still have that zest for life. And we came across people that seem to be completely perfect from the outside, and that zest for life is gone. So is that what you were referring to?
100%. And I'll tell you an anecdote which just reinforces what you just said. And I'm delighted to hear that you're asking that question. There was a person that I am close to, and he called me years ago. He was at either was the Cleveland Clinic or Mayo Clinic, I don't remember, but he was getting a cardiac cath. He had vague symptoms, and they discovered a moderately severe lesion in one of his arteries, and they were thinking about doing an angioplasty. And he called me up, should they do it or not, and I knew his medical condition, whatever, and I was not convinced that he needed that, and felt comfortable advising him maybe to hold off. So he asked me, what else could he do? So I said, call me back later when you're more stable, and we'll discuss it. And I went through this classic review of systems where you ask people about every system and whatever. And one of the questions I asked him was, does he suffer from tiredness and fatigue? And he said no.
Okay.
But this was the time when I was first working on this whole concept of vitality. So I asked him, as we finished discussing, on a scale of 1 to 10, where 10 would be a time in your life where over a period of time you felt particularly energetic and so forth, how energetic do you feel now? Answered 3.
Ooh.
A 3? Wait a second. I asked you a few minutes ago whether you're feeling tired. And he said, I'm not feeling tired. I said, oh, but why did you answer 3 on here? And we explored that, and it turned out he was dealing with a lot of stress in his life that had nothing to do with health. But we would have discussed it if I hadn't asked him that question. So he was dealing with a lot of stress. That's one of the 6 domains of health. And we wouldn't have covered them if we wouldn't have asked the equivalent of your zestful question. So just to now analogize, if you ask someone or go through the actual question we have to screen for depression, they may score 0 on depression. In other words, they're not depressed, but that doesn't mean that they're happy. So by
Right.
just looking at one end of the scale, you don't see the other end. You really have to look at the full spectrum of
Yes.
each of these.
Yes, that is so true. And I think you're 100% correct. And I had seen it, of course, as well, as a clinician, is that it's that mental vitality and that is really a challenging element to measure. And one of the things that I typically see in patients where I feel that they have this zest, they have this mental vitality, is that those people are curious, they have curiosity, they have an open mindset. So they are still looking to learn, even in their 80s. They're still looking for new experiences, whatever they could sort of, whatever excites them. And it is that vitality, that curiosity, that zest that I think not only is an essential piece of these 6 domains of optimal health, but honestly has a very strong influence on your other 5 domains. Because I don't think that with individuals who don't have mental vitality, certainly we know association with chronic diseases, especially cardiovascular disease, that's obvious. And as you described, but it would be so much harder for people who don't have that mental vitality to really excel, at social connections and purposeful living and emotional mastery. So to me, it almost seems like it's probably the most important piece, but you have them here sort of all equal in this hexagon. So I'm curious how you see it.
I don't know that one piece is more than the other. What I say is that these are all entrees toward more positive living. And either you're getting into a positive loop or into a negative loop. And I think there's a powerful and empowering message in all of this, because if you take one step in one of these domains, they are related to the others, as you point out, and you're on a track now to improve. The biggest mistake I think we make, and I think from that you've emphasized today, is the power of small steps.
Right.
That you just take with exercise, for example. Now we have these stunning data come out in the last 10, 12, 15 years with pedometers, with accelerometers, where we now know that any amount of physical activity you do, even 5 minutes, counts.
Exactly.
And it's a whole new way to coach people. But you know what happens realistically? If you start to tell people, wait, the guidelines say 30 minutes of exercise 5 times a week, your sedentary patients aren't going to do that.
That's
but if
right.
you say to your patient, wait, can you give me 5 minutes of walking per day? They'll look at you and say, doctor, what? They won't take it seriously. But now you can say, wait a second. Here, I can tell you, take it seriously. We got actual medical data that shows when people go from being sedentary to 10 minutes of intentional walking and some moderate pace for them, you're decreasing your mortality risk by about 20%.
Exactly. And that's a very strong data. I believe it came out from UK Biobank. So it is absolutely super strong. And, I talk to my patients about exercise snacks. And, sometimes I just film myself walking with my dog, which I'm going to do shortly. And that will be my exercise snack or 2 or 3 for the day, right? So the exercise snacks, the micro breaks, the incremental steps in building the optimal health. So Alan, in closing, what advice would you have for our listeners? They're looking at the 6 domains of optimal health. And just in case you're listening and actually not looking at the screenshot, this is a good opportunity to jump into YouTube channel to take a look at this. But the 6 domains of optimal health by Dr. Rozanski are physical health, mental vitality, emotional mastery, social connectivity, purposeful living, and stress management. So because there are 6, where would you advise a person who is thinking, sort of likes this and feels like they could build on this? What is a good place for them to start? Do they take some sort of like self-assessment, or how would they start with this?
Sure. Well, I love the question. As a preface to it, just listening to you talk, and in terms of these exercise snacks and the whole conversation, we're completely aligned. I mean, I think we could be in the same practice and give the patient the same advice.
For sure.
I'll tell you where I would start, and I wonder if you would agree. Any of these would be great starting points, but where I start with people is to get them more moving physically. Give me that 5 minutes per day. Give me that 10 minutes per day. When you move physically more, we are moving. depression in a way is a state of lack of motion. I don't think I can do anything and so forth. And even with depression, that exercise has been shown to be as potent as an antidepressant in the studies of Jane Blumenthal, for example, and others, as an antidepressant. It's really quite remarkable. So I start by getting people moving more. If I have to choose one, obviously different people will have a different preference for this or that. But if you're asking me just one, that's where I focus. Can I get people moving more and take it from there?
Oh, that's phenomenal. And I agree with you entirely. And, I feel like we need to have a whole episode or 2 or 3 just on exercise and what is changing in exercise science, because not only the exercise snacks, but even, the emergence of the role or recognition, how powerful resistance or strength training is, how it sort of provides differential benefits across different stages of life for both men and women. And of course, I don't know about your patients, but my patients are obsessed with creatine, and there's a lot of stuff that is going on. But this has been a super delightful episode. I learned a ton. Where can listeners get access to these 6 domains of optimal health? Do you have a website, a book? Like what do you have?
I do have a website. For years, decades, I was just in the academic space, trying to reach more physicians. And of course, I've always been teaching fellows and students and so forth. But I have now said, I've got to reach more of the public. And I established a website, which is growing, and I'm very excited by it. Just called Rozanski.com.
Okay.
And I'm on LinkedIn as well, so you can find me.
Excellent. Places. So what we'll do is that we'll provide the links to the Life Optimism assessment test and to Alan Rozanski's website, where you can find more information on the 6 domains of optimal health. And that will be something that our listeners can explore. And Alan, this has been really a fantastic information. I'm delighted to have had you on this episode, and I can't wait for it to actually air live.
Thank you so much. It's been a real pleasure.
You got it. Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Card Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Card Centers. If you enjoyed the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticcardcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.